um, questions that or comment you would like to say, please raise your hand and then I will go to you next. And there will be a photo session in the end. So if you don't mind, we're going to take a picture together later in the end. But you may leave after my closing statement in case you have other commitments. But we will have a photo session and then a prize raffle for the participants in the end. So yeah, that's all the housekeeping things I have for the briefing. Do you have any questions or do you want to add anything?
Not for me, thanks, Tika.
That's great. All right then. So we're going to start admitting the participants shortly. So if you would like to turn off your camera first and take drinks or etc., please feel free, and then I'll let you know when it's going to start.
Sorry, just to say, when you're interviewing the other, if we're not talking, should we keep our camera on for the whole session or off?
It's up to you. You can keep your camera on, but we have this spotlight thing, so there will only be 2 people on the spotlight at once.
Okay.
Thank you, and see you soon if you don't have any further questions. Hello, everyone. Welcome to our parallel discussion session today. So this is the health discussion chamber. Please make sure you're in the right place. And there are a few housekeeping announcements that I would like to make before we start. So this event is sponsored by BNI London branch, the University of Nottingham, and the Ministry of Tourism and Creative Economy of the Republic of Indonesia. Before we start, please allow me to introduce myself. My name is Kartika Saraswati. I'm a DPhil or PhD student in clinical medicine under the University of Oxford, UK, and I am your moderator for this session. A few housekeeping announcements. This session will be run in an interview or talk show format, around 20 minutes for each speaker. Then we will have about 15 minutes for questions and answers. So please do type your questions in the chat box along with your name and institution. In the end of the session, there will be a prize raffle. So please stay with us until the end. Because if you're not here when we call your name, then you cannot claim your prize. There will be a book voucher for one winner and 10 participants will be selected to be in the raffle for a laptop in the closing ceremony later today. That's it for the housekeeping. We will start now. Hopefully this will be a fruitful and insightful discussion for you all. Our theme today is Global Health Research Collaborations in Indonesia, Ensuring Equity and Increasing Capacity. This is an increasingly important theme in this COVID-19 pandemic era. This pandemic has highlighted the disparity between high-income countries and low and middle-income countries. Take one example, the COVID-19 vaccine. Its purchases and rollout have been dominated by high-income countries, while low and middle-income countries struggle to vaccinate their population. This gap is also reflected in health research, which is crucial to inform us on how to control this pandemic. Although the publications involving international collaborations from Indonesian institutions have increased over time, there are still challenges to nurture long-term, mutually beneficial, and respectful international collaborations. So, today, we will discuss Indonesia's role in global health landscape and the future of global health research collaborations in Indonesia, as well as how to increase Indonesia's global health researcher capacity and capability. So today, we have our honored panelists who will share their insights on this topic. We have first Bapak Pungkas Fajuri Ali, PhD, the Director for Public Health and Nutrition, National Development Planning Agency, Ministry of National Development Planning, or Bappenas, Indonesia. Thank you so much for being with us today, Pak Pungkas. And second, we have Bapak Iqbal Eliasar DPhil, the Senior Scientist and Geospatial Epidemiology Program Lead in the Eichmann Oxford Clinical Research Unit, or Yokra for short, in Jakarta, Indonesia. Welcome, Pak Iqbal. Thank you for being with us. And last but not least, Professor Elizabeth Ashley, the Director of the Laos Oxford Mahonsat Hospital Wellcome Trust Research Unit, or LOMBRU for short, in Vientiane, Laos PDR. She is also a professor of tropical medicine in the University of Oxford, UK. Welcome, Liz. Thank you so much for being here.
Thank you for having me.
Great. So first, we'll hear more about global health and global health research from the perspective of the government of Indonesia, and start with Pak Pungkas. I think Pak Pungkas has a presentation to share. Please bear with us a moment, and we're going to share the screen. There you go. So maybe if you can, oh yeah, okay, that's great. We can see the slide perfectly. So please go ahead, Pak Pungkas, the floor is yours.
Okay, can you hear me?
Yes, yes, very clearly.
All right, thank you. So good afternoon, everyone. Good morning in UK, I think. Thank you for the opportunity for these conventions for the Indonesian Scholar International Conventions. I would like to, well, my presentation would be only helping me. Probably mostly we can discuss later on because some of the questions by the organizer is really very tough questions. And I believe here we are here with Pak Iqbal, who are dealing on the daily basis on the research, including international research. In fact, we are also in the same group with Iqbal on the global burden of disease research, Iqbal. So I think we are in good hand if we're talking about the what are the problems in the international research. One of the questions that you have in the latest questions. Okay. So first question is regarding government Indonesia view on global health and who is in charge for handling this issue on the government side. Well, I think if you talk about the health issues, it's pretty clear in Indonesia, and we have been having this problem for quite some times. The most recent one is on the health security. I think that is the most recent one, and it's very relevant for us to discuss. Sorry, by the way, Dr. Kartika, how much time do I have?
For the presentation, maybe 10 minutes, Pak.
Okay,
all right. Is that okay? 10 to 15 minutes.
Okay, yes, sure.
Great, thank you.
Okay. So health security and health resilience basically is the most present issue now in Indonesia. And then the second on the inequity and equality. Those two problem is very chronic problem. We have been having this problem since I worked in Bappenas about almost 20 years ago. If you see the inequity, is usually mostly talking about the geographical inequity between the eastern part and western part of in Indonesia, and then also equality among social economic groups. The other problems that we have is double burden of malnutrition as well as double burden of diseases. Now, about around 70% of the mortality in Indonesia is caused by non-communicable diseases. So while at the same time, we still have a lot of problem in communicable diseases such as malaria, and then HIV/AIDS and tuberculosis, etc. Now, on the malnutrition side, of course, we still have the problem from undernutrition, but you know that Indonesia is also having a problem as well. I think the problem is also similar to the European country, which is the increased obesity. And that's because of the behavior of the people and other environmental factors. Now, we think about technological advancement as one of the problem because if we use the technology wisely, then we think that we can leapfrog for the achievement of all this problem. So basically, if we adopt technology, for example, digitalizations for healthcare, for example, I think that would be enhance a lot of achievements, such as to reduce inequity between regions. In some area that doesn't have any health workers there. We have a chronic shortage of health workers in the eastern part of Indonesia, and we can have an advantage by having technological and digital advancements. So who is in charge of this handling this issue in the government side? Well, it's multidimensional. If we are approaching the health as multidimensional issues, then it's not only the job of health. We adopting actually, for example, Kermas. Kermas is healthy lifestyle. So now we are realizing that Ministry of Health is mostly dealing with the curative side on the treatment of the people or the care. But if we don't deal with the prevention side, promotion side, then the problem will still continue. This area is actually mostly lies under, not under the Ministry of Health. Now, then the question is, how do we integrate? How do we work together? And I think still one of the problems, if you remember, we have a report from the on the WHO on the social determinant of health. I think we still have struggle on how to implement this on real practice, because every ministries have their own not idea, but have their own job to do. So if you put another job, they think that this is another job. So the key is how to make a health as the mainstream for the whole sectors. Okay. Now, I would like to move to the second questions. Now before doing that, so this is summarize the previous slide is summarize all of the problems that we have and how we have to deal with those. So basically our approach is to improve health services toward universal health coverage. So USC is the main theme for the next 5 years by prioritizing the primary healthcare and encouraging promotion and preventions by using innovation and technology as a leverage to all of those issues. On the second questions on the reflections of the pandemic COVID-19, what is our visions? And then will there more emphasis on global collaborations? And well, I think this is very, very relevant to the Indonesia, especially today, because we have the highest cases of COVID now. I think we never thought that we will have a second wave that as high as now. We have a previous predictions that if everything works well, it should be subside by September this year. But in fact, is now going exceeding the first wave. We do have some Papanas actually having some study on what is takeaway from the current COVID-19. So of course, it has been shown that health actually is very, very high contributions to economic growth. I think this is also a new paradigm for us who are dealing daily on the health economic. This is not something new, but those who are mostly dealing with the economic only, not really relating to health, this is quite a proof, that we cannot develop, we cannot advance our economy without securing the health of the community of the people. And this is very clear in the current annual work plan that we have this year and next year. We put the health system reform as the first to be taken before doing economic recovery and economic transformations. So now you remember it's very difficult for us to talk about hand washing, for example. We have been campaigning for quite sometimes for probably 10 years, and it's quite difficult. Now everyone is understand that hand washing is very important. So the basic idea of health as I call it social protection for the health for economic growth is proven now. So you can see from the spending of the governments is always prioritized for health, especially to suppress the COVID-19, because that's the requirement for for us to grow. We also have a policy directions on this science and technology developments. This next slide. So this is all in the medium-term plan. So we have Yokra NRP flagship. Basically, is a national plan for research until 2025. So we have a roadmap already, and now BRIN, Badan Riset Nasional, is one of implementation of those undang-undang. So law on how to implement this flagship. We have been identifying several areas, mostly four main area, as we thought those will give a leverage to our economy. First is on the food and beverage, second on the pharmaceutical, the third on chemical, and then electric industry, and the fifth one is on the automotive. So those five industries deemed as part of Industry 4.0 in Indonesia. So remember that pharmacy is one of the those priority in the next 5 years. Another policy would be developing a research powerhouse. Basically, we have to improve human resources and then increase the quality of research and development spending. In our Indonesian 2045 visions, we have a target of increasing the spending for research and developments. I think this is about 3% of the GDP, which is very high. That's not only from the governments, but also for the business and private sectors. You know, in the new regulations, there will be also some incentive for industry who are doing the research as well, such as tax reductions. And then the fourth strategy would be creating an innovations ecosystem with the triple helix corporations. One of the science technopark now has been prioritized by the governments, but I think I personally believe that we don't have to rely only on science technology part, but we also have to rely on the research community, including from the university. This is only sharing next slide on the several national research priority. As I mentioned earlier, now is only 0.25. We have to increase it by next 5 years. Yeah. Now on the COVID lesson learned, kita langsung ke nomor 10 ya, slide number 10. So from the COVID pandemic, we can learn that one of the crucial issues on the research is utilizations of technology innovations. Yeah. We have been doing a comparison study in Indonesia and Korea, Republic of Korea, South Korea, and we found that one of the big distinctions with our pandemic interventions with Korea is on the technology. So they learn from MERS-CoV and SARS-CoV, and then they develop the surveillance systems. And so when the pandemic in place, in coming, then the system is already in place. We did have some joint external evaluations actually from WHO, and we thought that during the evaluations everything should fine on the health security and resilience. But when the wave of the pandemic coming, then we realized that something not right in our health system. So that's why we developed the current health system reform in our annual planning. It started from 2020, and hopefully by 2024, our health system has strong enough to face if anything's coming on the pandemic.
Pak Pungkas, sorry, you have 3 more minutes.
Okay.
Thank you.
All right. Okay, on the next slide, I can share later on the slide. Basically, this is on the policy developments, policy directions on the funding resources and research on financing. So we be looking a lot of ways to fund our research. As I mentioned earlier, our research spending from the government is quite low, and then we would like to increase it by 2025 to up to almost 3% of GDP, which is it's not easy. It's a big endeavor, and then hopefully we can do it. And then I think funding is not only the only one. We also have to make sure that human resources and infrastructure is there. Otherwise, we cannot use properly. And then we have to have a map on what kind of research that we need to improve. Now, there is questions on the main assets from Indonesia. Is Indonesia important actors in the global research or no? So I would say that Indonesia have very high potential in health research. First, we have a high biodiversity. In fact, if you look at the regulations on Undang-Undang Signas, most of the Undang-Undang Signas try to protect this in the system of research. So we have a lot of natural resources. We have germplasms, traditional medicines, and plant-based medicines. We remember that a few years ago, we have a dispute with WHO on the material transfer agreements on the disease because of autism. And then second, I think one of the potential research is on the some tropical diseases that is difficult to find if you are living in the subtropical countries. For example, tuberculosis is still quite high, and then we need a lot of resource on this issue. We have very specific tropical diseases, such as neglected tropical diseases, such as schistosomiasis, and then rabies, and then dengue fever, and etc. That probably is difficult to find in subtropical countries. And then we have a high political commitment, at least on the commitments. We still need to prove of it. And then in Indonesia also, there are a lot of survey. And I would say that we have a lot of big survey. This is one of the three examples of in the health sectors. And the survey the data is pretty much not used widely. The survey is there, the data is there, but because of the bureaucracy, it's not easy to access the data. I think this is one of the problems that we need to solve, but actually we have a lot of data. Yeah, big survey, national survey every year in every areas, but the usage of the data by research community is quite low. Not because of the interest, I think because of the system. I think this is one of the problem that we have that we need to resolve. And well, what is the government role?
Sorry, yeah. 1 more minute.
Okay, thank you. And I think this will also the last part of my presentations on the government roles on global health research in the future. So we hope that the governments, as regulators, as facilitators, also creators, and of the user of innovations will play important roles in the future. And then even though, there is a big question on, we don't know how the direction of the current arrangements on the brain. Yeah, I think Pak Iqbal is a part of, Pak Iqbal also can help us in answering these questions. There are a lot of questions on the role of the brain. But if you look at the, the motivation of the brain is actually really to improve research and development in Indonesia. So that's the philosophy of it. Probably, I think along the way, we need to improve here and there, but the commitments or the initial commitment of the governments to improve research and development is quite high, especially on health issues. Currently with the pandemic, it could be a trigger for the research in the health issue. And my last comment is one of the area that probably we lack of on the research is on the medicines. the medicines and the vaccines, we probably have a lot of research on communicable diseases. But if you talk about research on the medicines, on the vaccination and the vaccines, the efficacy is quite scarce. So that's one of the area I think that is possible probably in the future. We are not talking about the individual medicine, but overall, even overall medicines is something that probably will be have no potential from Indonesia. With that, I would like to close my presentations. Ibu Dr. Kartika, I'm sorry, I couldn't really answer your last questions on how to avoid sometimes overcomplicated bureaucratic barriers. When I look at the regulation, then there is a barriers, but I don't see up to now problems, even though we have the regulations having collaborations between Indonesia and internal research. But I believe that collaboration is one of the way how we can, dealing with this problem. With that, I would like to end my presentations. Thank you very much.
Thank you very much, Pak Pungkas. Yes, indeed, I totally agree with all of your points. And it is great to see that the government actually have a roadmap, a clear plan and vision, and a path in mind to operationalize this and to assert Indonesia's position in global health research. I also really I'm really happy to see NTD neglected tropical diseases as one of the agenda. Yeah, thank you so much, Pak Pungkas. And for now, we're going to move to the next session. We're going to hear more from the perspective of an Indonesian researcher. So we're going to hear more from Pak Iqbal Eliasar.
Thank you.
Hello, Pak Iqbal. How are you today? I hope you're
Very
doing
good.
well.
Yeah, thank you, Kartika.
So yeah, let's start. So what is your view on the current landscape of global health research in Indonesia? Is it fair to say that Indonesia has been underrepresented in this field?
Yeah, thank you, Kartika. Good afternoon, everyone. Good morning, friends in UK. This is a very smart question, but actually it's indeed a set question. So to respond this question, well, I need to look at the statistic, for example, the research output or publication output, to compare Indonesia position relatively to the other countries. So I'm using the international science ranking released by Samigo institution ranking. They develop a quantitative metric to look at the total number of documents published or the publication output metric, and for the last 25 years. So globally, Indonesia contributed only 0.3% of the total publication or scientific outputs. So it's placed Indonesia at the rank 45th, USA number 1, China number 2, UK number 3. USA contributed over 20% of the total scientific publication globally. In Asia region, among Asia countries, Indonesia is ranked number 10, below China, Japan, India, South Korea, and Taiwan, Hong Kong, Malaysia, Singapore, and Thailand. Simply speaking, if you would like to compete or compare with US and UK, we need to increase, Indonesia need to increase the production's output, productivity rate. So let's say if you publish one paper in a year, you need to publish at least 20 or 70 publications in a year. So this is the comparison of between Indonesia and then other countries. I agree with Pak Pungkas mentioned earlier that there is a gap. The gap becomes wider when we look at specific or the particular field. For example, in medicine, Indonesia only contributed 0.1%. In neuroscience, it's even worse. It's less than 0.03%. We have relatively good contribution in environmental science. It's 1%, but it's not enough actually. So this is the landscape of the global contribution of Indonesia contribution to the global scientific endeavor.
Thank you for the answer, Pak Iqbal. Yeah, it's so yeah, I think we can say that Indonesia is underrepresented, being the fourth, the having the fourth largest population, being the biggest economy in Southeast Asia. I think it's fair to say that yes, Indonesia has been underrepresented in this field. So, what do you think is the cause of that lack of visibility in global health academia? What are the barriers?
Yeah, I think we have seen the possible explanation or possible reason for this low visibility of Indonesia in the global context. So let me start from the technical perspective. So one says that Indonesia has a weak English writing. With the problem with Indonesian scientists, but I think it's good to start from now, especially when we are going to have the Badan Research and Innovation National Research and Innovation Agency. They need to think about a center of publication support that allow them to help Indonesian scientists to proofread the article before the submission. So we also find as a reviewer in journals, I find there's a problem with our Indonesian colleagues. And I think the second part is also the funding support. Yeah, Indonesian scientists need to have continuous funding support for publication fee. You know that to submit a publication, you need to pay at least 2,000 or 2,500, and some in few journals we need to pay publication fee for $3,500 US. It's not a small amount of money for a small project like Indonesian colleagues facing now. So and the other thing is I'm thinking about the volume of the PhD graduate who actually working in the R&D. So let's say, for example, in Indonesia. When we see the statistic, the PhD graduate who actually work in R&D is Indonesia is 200 people per 1 million population. When we compare to US, UK, or even China, their rates is reached to 4,500 people per 1 million population. It means that we need to increase at least 20 or 25. The volume, the volume of PhD graduate who actually work in research in Indonesia. So because the PhD skill set is very important. So as they need to assume their role as a leader in generating idea and let's say the writing the grant proposal is not easy, and convincing the funders is very tough. Initiate collaboration, so we are sometimes restricted by the bureaucracy. Developing protocol, management, publication, and dissemination also. So I think there is a need to increase the number of PhD graduates actually to work in the health research, especially in Indonesia. Bureaucratic, I agree with Pak Pungkas. He mentioned clearly about the bureaucratic, especially in the research administration. Most of my colleagues in university or probably in research institution, their spending time are mostly used for the research administration. It's not good for the scientific environment. So I think that's all my comment for what actually. Yeah.
Yes, yeah, I certainly identify with those challenges, Pak Iqbal. I would also like to know more. Pak Iqbal, you're working for Yokra, the Eichmann Oxford Clinical Research Unit, which is a long-term collaboration between the Eichmann Institute, the University of Oxford, and Wellcome Trust. So I think long-term collaboration can contribute to increasing capacity of local researchers. So could you tell us more? How was Yokra established and what was the idea behind it?
Yeah, thank you, Tika. Yeah, it's good. It went back to 2007 and 2008. The idea of the Yokra was created by Professor Jeremy Farrar. He was at the time director of Yokra, Oxford Clinical Research Unit in Vietnam, and also now Professor Jeremy Farah is the director of Wellcome Trust in UK. And also Prof. Sangkot Marzuki, at that time, he was director of Eichmann Institute for Molecular Biology, and also Prof. Kevin Baird. Professor Kevin Baird was assigned as head of the unit, and he is now director since then. Actually, the core business of the Yokra is clinical trial. So the bread and butter of the business is the clinical trial. And the skill of clinical trial set is very expensive, and it requires a long time to train and to giving experience to the Indonesian scientists as well. They need what we call it good credential and also the international compliance. So the objective of those three founders actually to tackling important infectious disease problem in Indonesia and the regions, and also to nurturing young Indonesian scientists, stimulating the research environment, creating a center of education, training, and research as well as the public engagement in science. So Yokra now is one of the two international units in Eichmann, under leadership. Eichmann is under leadership of Prof. Amin Subandrio. It started from 3 people in 28, but now it grows to 70 people. Yeah.
So it has been established for around 15 years now. So how to maintain this long-term collaboration, Michael?
If I can say that, I think strong leadership in science by Professor Kevin Baird, by the Professor Sangkot, and also by Professor Amin Subandrio, and the trust among them, and also what you call the ownership of the project, and the opportunity to make a difference. So Eichmann Institute has an international brand because the Christian Eichmann is a Nobel laureate, and it is good. It's a good brand to start the collaboration with others. And not to forget that we are now standing in the golden triangle in research. So Eichmann Institute is one of the well-known institutes in molecular biology and genome. The other one is the Faculty of Medicine next door to the Yokra. They also have the Center of Medical Research and Education, and they have about 100 medical students in the Faculty of Medicine, and next to the unit as well, there is a national reference of hospitals, crypto hospitals, and with the capacity over 100 beds. So the link between the Faculty of Medicine, Eichmann Institute, and also the hospital, the crypto hospital, is a very good asset to us. The maintain the relationship, of course, in 2011. Oxford unit and the Faculty of Medicine has established a laboratory in the Faculty of Medicine compound, Yokra, and the idea of to create the laboratory is to strengthen and expand the clinical research capacity. Yeah, this I think that's my response to it.
Oh, thank you. So yeah, I would also like to know more. What is Yokra's vision for the future of global health research in Indonesia?
Thanks. I think the vision is ambitious with the support by the three strong collaboration that I mentioned earlier. We want to be a regional center of excellence in medical research. As I mentioned earlier, the core business is in clinical trials, and then we want to attract as well the young scientists to be part of the team, and then create in-house the capacity to do the clinical trial, to analytic, or we want to think about how to improve the young scientist career development as well. So now we have 4 research programs in our unit. The first one is clinical infectious disease, led by Dr. Rob Hammers. And the second one is malaria research program led by Professor John Kevin Baird. And the third is a program community intervention by Dr. Anurag Shankar. And the last one leading by me as geospatial epidemiology program. So, yeah.
Yeah, that sounds great. I think sometimes being ambitious is good. Last question, Pak Iqbal.
Yeah.
So equity is the heart of global health.
Yeah.
And likewise, equity is also crucial in global health research collaboration. Do you think your crew has been able to achieve this? And how has the practice in diversity and inclusion been done in your crew?
Yeah, as we know that in Yokra, our blood source in activity is competitive funding and international collaboration. So we are still now continuously improving equitable partnership. Let's say, for example, most of the time when the collaboration starts when the research funding call is open and we had a little time to expand the network. So Yokra prefers to look for our long-standing partners, friend first, and then expand incrementally to the other bigger network. I think the first thing is we need to have a clear mutual expectation from all partners. We need to several meetings to clear the issue, suspicious, and also the expected outcome or expected compensation for that. We need to make sure that we formulate the research question collaboratively and also the scientific conversation, so to fill the gap between the all partners. Yeah, we also try to give the proper credit to the all partners to know responsible to and who is responsible for what, and also the clear responsibility as well. So I think a good practice for Indonesia, like say Yokra, because we assign the Indonesian researcher as principal investigator of the project, and we give the responsibility and also they encourage them to be the first author. So I think this is how the Yokra practice.
Yeah. Very nice, Pak Iqbal. Many thanks for your answer. Hopefully we can increase the visibility of Indonesia in global health research, since there is so much potential, I believe. And for the next session, to get a more comprehensive views and compare experiences with other settings, we have Professor Ashley with us today. So hello, Professor Ashley, how are you?
I'm very well, thank you, Tika.
So yeah, let's start. So you have experience both working on health research in high-income settings, like UK, as well as the more resource-limited settings in Southeast Asia. How big is the gap on research infrastructure and capacity do you observe between those two groups? And what are the main factors that have caused those gaps?
So thank you for the question. First of all, I'd just like to make it clear that I'm talking from my experiences in Thailand, in Myanmar, and in Laos, and I've never had the pleasure of having a collaborative, working on a collaborative project in Indonesia, but I think some of it may have some resonance. So if we start thinking about infrastructure and capacity, so ability now with what's available, I think the gap is significant. And the main reason, I think, is, as Dr. Pankaj was saying, it's probably about investment. So if we look at the investment in research and development in the UK, where I am from, every year, or in about 2019, it was 18 billion US dollars. And that's around 0.6% of GDP. And I think we heard today that at the moment, Indonesia is investing around 0.25% of GDP in R&D. But I think the gap is closing in some Southeast Asian countries. So if we look at Thailand, they're increasing their investment year on year, and they're now above 1% GDP. But that's still only $5.6 billion. So that's 1/3 of what the UK is investing, and that's with the same population size. So of course, this then affects infrastructure and capacity. if we think more about capability, I think we all agree that within Indonesia, within other Southeast Asian countries, there are just as many talented researchers around, but of course, there are barriers and inequalities. And, you know, we've heard about English. This is obviously a key barrier because the dominant language of science is English, and how success is measured is often in written or spoken outputs. Lack of time. So what I see is some of my colleagues in low middle income countries need to supplement their income. So they're doing private clinics in the evening or private lab work. This then means they don't have enough time for their research. I've also seen that often the talented researchers in LMICs are identified by the government for their drive, their talent. And so they also have other government responsibilities, they're on committees, or maybe they're very involved in education. So they have these multiple hats, and this also diverts their time away from research. Moving to another cause of the gap, I think we have to acknowledge quality of education. I don't think the global rankings of the 100 top universities are, you know, they're not perfect by any means, but if we look in them, they're dominated by the global north. And when I looked at a few this week, I could only see one LMIC university from Southeast Asia, I think, which was University of Malaya. So, you know, this is probably also contributing, but I think, you know, this can change, and Thailand has its new economic model called Thailand 4.0, and a key part of that is that they are aiming to have 5 Thai universities in the top 100 in the next 20 years. So, you know, why not Indonesia? Why not other countries? The next contributor to this gap is something you alluded to in your introduction about equity. And there is a clear power imbalance at the moment in global health research. And, you know, this is where the funders are setting the agenda often and generating the priorities again from the global north, and not necessarily having a shared decision-making process to say, you know, what should be funded right now. So, you know, this clearly exists. And also the funders have a habit of moving the goalposts when people are applying for money. So we've heard that the Eichmann Institute is very strong on clinical trials. Many agencies now will say you can't apply for clinical trial funding unless you have this, you know, trial unit, which can ensure you can do this research to the international standards. So this just puts another obstacle in the way often for LMICs. And allied to that, you know, it's a bit of a game when you apply for a grant. You know, this word is called grantsmanship. And, you know, there are tricks to it. And I think we need to be able to, you know, let everyone understand how this system works so that they have a fair go when they're going for money. Before I stop, I'll just say one more contributor, I think, to this inequity is technology. So if we look at the omics revolution of the last 10 years, this was a very expensive technology. It arrived in, you know, richer countries first, and it really facilitated, again, a return to this parachute type research where, you know, people would go into low middle income countries and take specimens out because the technology was somewhere else and get all these high impact outputs. So, you know, I think these are some of the reasons these gaps exist. What's being done to close them? I think there is now finally acknowledgement of inequity. I think a number of groups are talking about having a more equitable framework for conducting research. I feel at the moment it's still a bit at the COVAX stage where everyone believes in the idea. We're not quite seeing it being implemented, but I do think there is growing recognition that we do have to level the playing field more.
Thank you, Liz, for the comprehensive answer. Yes, I can also identify to some of those. So moving on to the next question. So you are working in the Laos Oxford Mahosat Hospital Wellcome Trust Research Unit which is a long-term collaboration embedded in the microbiology laboratory in Mahasat Hospital in Vientiane. So how big are the challenges in attracting funders and maintaining long-term research collaborations in your experience? And how do you and the people working in your institutions work to overcome these challenges?
I honestly don't think funding is the biggest challenge now. I think there's such an appetite for global research.
Mm-hmm.
And global health research these days is very multidisciplinary. So, you have people wanting to collaborate in mathematical modeling, in clinical research, in social science, in health economics. And there is funding available. As you mentioned, I'm very privileged to work in this Wellcome Trust funded network where we have core funding from the Wellcome Trust that is renewed every 5 years, provided, we do a good job. And this gives us a lot of stability. It means we can take a more medium to long-term view with our research. We are always trying to attract money to top up. And I think one of the best ways is to have a slightly diverse portfolio of research. So if something is not going well, then maybe you can be succeeding in other areas. We do simple things like we have people in our network whose job is to summarize for us all the funding calls that are out there. So we don't have all the researchers, looking around on the internet. The information is made available for us. But I think in science, there's always an element of having to pivot slightly towards what the funders are asking us to work on. But I don't think you always have to sell your soul to do that. I mean, I think if we look at antimicrobial resistance now, is before COVID was one of the highest priority topics on the global health research agenda. But I think most of us would feel quite comfortable to feel that's a problem we want to tackle. So yeah, I don't think people should be put off always by thinking they can't get funding.
Yes, I agree with that. You also touch on this parachute research or safari research or helicopter approach, where people from we can say more developed institutions came in for short-term project and then just go afterwards. I think long-term collaborations and capacity building can be a way to address the negatives of this approach. And from your perspective, how important are long-term collaborations that include capacity building for local collaborators?
Yeah, I do think, maybe I'm biased by my experience, but I think long-term partnerships can offer so much more than short-term ones. And it takes time to build partnerships, and in 2 or 3 years, I think you see these attempts at capacity building, but in many times they end up, I would say, being rather superficial in my opinion, and they don't lead to this sustainable progress or improvement. So I think, my personal view is that long term is better, and that there's a lot more productivity from a long-term collaboration, and a lot more can be achieved. And particularly in training, I think we can't all just get a PhD in 3 years. It takes time to be ready for it, and having a long-term collaboration can just give you that right conducive environment with more mentorship to get to reach your goals. So yeah, I would definitely think they are preferable.
Yes, I do agree that mentorship is very important. Wellcome Trust has a history of funding a lot of long-term collaborations, like the Oxford Tropical Network, which Lombro is a part of. Can you tell us how the collaboration can be very successful?
Yeah. So the way Wellcome works is because it's funding this 5-year cycle, but it has this longer term approach. So our Bangkok unit has been there for 40 years. We have another unit that's been in northern Thailand for 30 years. Our unit in Laos has been here for 20 years. And what's quite interesting is that if you look back over 20 years, there were things you started maybe with a small amount of money, which weren't really high profile projects that have just been able to grow. So for example, we've had people in our network who had a passion for intensive care, and they just did some training sessions over the years. And now, 20 years later, they've set up this huge platform of collaborative research network in LMICs based in critical care around quality improvement. So I think you get these, by having just being there for one time, a prolonged period of time, as well as these 3-year really big, nice clinical trials or pieces of research that get done, you can get these spin-off benefits which evolve naturally from the collaboration. And allied to that is, of course, training. I think you give people this long-term stable career where they can grow from being a master's student to a PhD to a postdoc to getting their own Wellcome Fellowship. And I think Wellcome is different in terms of trying to give more equitable opportunities. So they have had this international fellowship scheme for many years, which is designed for LMIC researchers to compete for very competitive fellowships, but they can fund people for up to 8 years, allow them to be independent and lead their own programs. So I think Wellcome has really contributed a lot to global health partnerships over the last 40 years.
Yes, 40 years, it's been a long time. Do you have any advice, Liz? What should local institutions prepare to attract international collaborators and funders?
So for researchers or local institutions, I think what again, mainly colored by my own experience in our network, but I think starting small with a grassroots collaboration is a really good way to start. So I would say, find something you're interested in, approach people that you've heard of that might want to work with you, and see how that goes first, because relationships are also very important in global health collaboration, and you don't want to end up committed to some high-level collaboration with another institution, where your government's been involved to help you set it up, if you don't really know if you can work with these people. So I would start small. Don't neglect the administrative side in your institution. A collaboration can fall down because you can't receive grant money easily. I've had partners in some LMICs where they don't have an institutional bank account where they can easily receive funds. Funders are not able to pay into people's personal accounts, however trustworthy they may be. So you have to sort out this admin side. If you are approached or you're starting a collaboration with a foreign unit, make sure you are represented fairly. If there's a grant application, make sure your name is on it as a co-applicant and you're not just there as a kind of contributing partner. So get your role established very early on. And then a final comment, which I think for students is no problem, is to be responsive. But I do see in some countries I've worked in, people more my age have not embraced email very, very strongly. And, the business of decision-making and collaboration is done face-to-face or picking up the phone. But, if you want to work with overseas units, you have to be replying to your email, very responsive as well. But I'm sure I don't need to say that to Indonesian students. That would be my advice for local institutions.
Yes, emails. Moving on, how much is the role of the government of countries that you've been working in supporting global health research collaborations in your experience?
So I have had a really varied experience, and there are very different ways of doing it. So in Thailand, we collaborate with Mahidol University, so a very big established university, and they manage the collaboration with Oxford. So we have no real contact with the government. It's all handled by the university. My experiences in Myanmar and in Laos were very different. In Myanmar, I moved there quite soon after the country was opening up in 2016 after the elections. And there was a very cautious approach to collaboration with foreign institutions. And I heard bureaucracy was mentioned earlier today, and there was a huge amount of red tape, and it was very, very slow to get approvals for anything, and many, many layers, which did really impact on research to the point where sometimes we lost grants because we crossed the deadline for spending money before we had the ethics approval. So this was very detrimental. And then moving to Laos, where actually it's a very small country, especially compared to Indonesia, so 7 million people. So that's probably smaller than many cities. And so everyone knows each other. But I find the government has a very pragmatic approach, extremely open to international collaboration, and tends to cut through bureaucracy, actually. I think, again, because it's quite a small country, so incredibly supportive of research. So yeah, it can vary a lot.
Yes. Last question to follow up on that. Do you have any advice for the government side, based on your experience, on how to make sure that collaborations are sustainable and research are flourishing?
So yeah, so I think, be open to a medium and long-term view of a collaboration. Once you can trust the partner, so you might have a pilot, probation period, but I think, think a little bit long-term. Engage with your local researchers to make sure you're aligned in thinking what the research priorities are for the country, and aim to come to an agreement with the partners that's mutually beneficial and equitable. I would encourage governments to be demanding, but not unrealistic. If someone like me, if our institution is coming into your country, we are the visitors and the guests, and we are here to abide by the country's, rules. And so I think it's important to say, what you're looking for from the collaboration, but at the same time, understand the context, the research context. We as researchers also have to respond to funding bodies. We can't always raise money for what everyone would like to research on. So there's an element of compromise there. I think the other thing to say is there may be other ways that research can benefit the country whilst you're building capacity. So for example, in Laos, and a model that's been used quite a lot in our network is to set up in a hospital and help support the diagnostic laboratory. So in that way, the patients benefit, the health of the country might benefit, and then you're also generating country-owned data, which can contribute to research. And say, the example of AMR again, we ended up last year, we had 20 years of jointly generated AMR data just because of how the collaboration had started. And then the final one, I would try and cut through the bureaucracy if possible. So just make the processes as smooth as you feel comfortable with, and also create mechanisms for your universities to be able to receive research funding locally without having to go through many, many layers in order to work. So yeah, that would be my thoughts.
Thank you so much, Liz. Thank you for sharing your experience. I have learned a lot from your experience, and hopefully we can extract relevant approaches and apply it to Indonesia. Well, that was a very interesting and insightful discussion. We are now going to move to the question and answer session. So I'm going to load the questions. First question from Hudri from Coventry University. I think this is more specific to Pak Bungkas. Why Indonesia cannot lead the vaccine discovery, at least for just our own vaccination, because it is said that we have enough experts to do so.
Okay, thank you for the questions. I think we do have very strong institutions in this issue, from Eichmann, for example, and then we have a company that produces a vaccine and exported worldwide up to 162 countries, which is Bio Farma. But in terms of COVID, I believe that we don't have a previous or experience in the producing for influenza virus, for example, for MERS-CoV or SARS-CoV. I think why other countries is very quickly in developing the vaccine, because they have a template for producing such vaccines. We have experience in producing basic immunizations. We producing a BCG, and then we produce a lot of vaccine for MR and all of those things, but not on the COVID. But I think once we have this experience now, we have developing Pak Iqbal kalau nggak salah 6 called vaksin merah putih, led by several institutions. And I believe once this has been produced in late 2022 or early 2023, we have very strong capability in doing it. And now we developing another industry to produce the vaccines. So I think this is my simple questions. Answers. Thank you.
Thank you so much, Pak Bungkas. Yes, I think being able to produce and have our own vaccine is crucial at this time. Moving on to the next question from Andrew Rizal from London School of Economics. I think this is more for Pak Bungkas and Pak Iqbal, if you want to add. Is there any agenda for policymakers and scientists to renew or make a bit better bureaucracy? Because it can hinder us from reaching a better achievement.
Yeah, that's that's very tough questions. I think bureaucracy was there to create a bureaucracy, you know. That's why bureaucracy is there. We have to set some rules and we follow the rules. But I think the establishment of brains and the willingness of Indonesia to increase the spending for the GDP research by 3% GDP by 2045, it has to come up with some sort of improvement on how we administer research and development in Indonesia. Otherwise, it will be very difficult, you know, for improving research and development. I think one of the things that is in place right now for the brain, for examples, it has to follow a certain ideology. That's the regulation is coming from the ideology side. That's why you see the structure of the organizations and how the board of penasehat is very linked to the political setup, and those also some of the questions from the research community. But at least I think we have intentions for increasing the research side. I think this is already the positive side of it, and by a lot of improvements, a lot of inputs from the research community, we should be able to improve it. You know, a lot of the regulations as a consequence of this purpose is still not there. So we have a lot of room for improvements in the coming regulations, because a lot of regulations need to be established in implementing those undang-undang Signas and I think Pak Iqbal can answer better than me on this issue.
Thank you, Pak. So I'm not a bureaucracy person, so technically, Pak Andrew. So we are now facing the lacking of the sense of crisis, actually. So we have experience when we applied for approval for opening our study site in several hospitals. So there is a lot of bureaucracy in doing this kind of research in the COVID. This is for example. So the second thing is if you see the Indonesia as the health burden of Indonesia, let's say for example TB. Among the Southeast Asian countries, we are the number ones. We have what do you call it? The burden, the year of life loss due to TB is number one among the Southeast countries. So we need to rethink about how to have a better sense of crisis and also to make it simplified, especially in getting approval, and also the time is sensitive now in terms of what do you call it? In terms of granting or writing, and also and how to develop collaboration, and also to set up the new study site, because it's very important for the achievement of research. So that's my point of view. Yeah.
Thank you, Pak Pungkas and Pak Iqbal, for the answer. Yes, I think especially for research in pandemic setting, time is very, very important. Moving on to the next question from Niken Ayu Pramesti, University of Jember. I think this is for all of the speakers. I believe that Indonesia is able to find new breakthroughs, innovate, and solve problems that exist primarily in health. On the portal Garuda, Sinta, and other portals, many studies have even been published. So Portal Garuda and Sinta is a database for scientific publication. But what I see mainly right now, the general public doesn't know about those researches. Most of the information published is always about the problem, so it tends to be negative. What do the speakers think about this, and what is the best solution for us as young people to overcome this? Maybe we start with Liz.
Thanks, Tika. I mean, I think I'll probably start with you, which is public engagement. And public engagement in science has been growing and growing over the last 5 to 10 years. And I think we all realize now how incredibly important it is. And I think it's just about trying to get our communities just make science part of their the way they see everyday life in a way. So just raising awareness, and that can be done in lots of different ways, in schools, through art. There are many different fora where we can expose the public to science. And also, I think as researchers, sometimes in the past, we've just been very, very bad about disseminating our message in a really good way. So we put it in a journal and then, that's it. And I think young people now are much more savvy because of social media, with communicating. So I think, if you all have your own Twitter accounts and figure it out that way. But yeah, I think now we know public engagement is a crucial part of communicating science.
Thank you, Liz. Pak Iqbal, maybe you have any comment?
Yeah, I think lesson learned from the COVID is very important. So before COVID, mostly of my work is focused on job and the laboratory and the field. But because due to COVID, the researcher need to go out more to outreach the population, to share insight, and including writing the popular article. This is very important. Sometimes when we publish the journal, it's very complex, very technical, but we need to make it popular to be easy to understand for the general population. So I think I agree with the public engagement and more discussion with the young people as well.
Thank you, Pak Iqbal. Pak Pungkas, do you have anything else to add?
Yeah, I think Papanas is one of the ministries or bureaucracy, you can say, that is pretty much open to the research and development, because we also creating our own study as the basis for planning. And in fact, one of our strategy for RPGMN 2022-2024 is always evidence-based policy planning. And we have very close collaborations with the Litbang, with divisions in the Ministry of Health. And if you look at our strategy, our targets, it's pretty much based on logical framework, and we always use a basis science or evidence-based as much as possible. So we actually lost, with the a lot of survey that is conducted by Ministry of Health now is not there because of the merge into the brain, and we don't know yet what happened in the brains after this. But we are one of the institutions that missing a lot of information from the Litbang once their job is under the brain. So we looking forward on how brain will manage of it, and our encouragement for the research is always continue. And in fact, if you look at the process of development, developing the medium-term plan, we use 1 year specifically for research. We call it health system review, which is doing a lot of topics. In the latest RPGMN, we conducted 11 topics for this as the basis for academic background for formulating the planning. So we are welcome the engagement, but I think the problem that we have, especially when we dealing with the research institution, is that we are very practical. The government is very practical. Sometimes that is found as significant under the academic papers, probably is not that significant in terms of implementation, right? So if these research communities can have discussion prior to doing some research, that will be more beneficial for us, because this is some area that we need, and then with the help of research institutions or community, we can have the proof to move for planning formulation.
Thank you for your answer, Pak Pungkas. Yes, knowledge translation is very important. The next question, following up on that knowledge translation, this is from Pratnya Kirana from Lab School Jakarta, SHS. From the first day of the conference, I have learned that we have a lot of resources and experts, but the impact of our research is still very low. Most of them stated that the main problem was funding. But if funding is not the biggest challenge, what is the main problem, and what's the best solution? Maybe we can start with Pak Pungkas.
I think collaboration is one of strategy on how to improve the use of the research. I mean, as mentioned earlier, if we can have some discussions, because we have a lot of questions, a lot of things need to be answered, need to be proved by the data. And then if the research community knows what are our problem, then the research community provide us with the evidence, then link and match is there. As you mentioned, one of the problem is on how to bridge the research into policy, and it's not easy. The policy cycle is very, very fast. One of the example, and we're doing some research on the projection of the COVID, and then we did it for 3 months at least. But you know, the minister is asking us and then give us the projection for the stunting, and then what do you need next week, for example. So these are the very practical question. To the timeline, the momentum is also very important for study to be used. Yeah, we can have a very good evaluations, impact evaluations, but the result is coming 4 years after the program started. So that's why the impact evaluation sometimes is very important for the long term. But for medium and short term policy, sometimes it's useful because you're conducting something that's already hit there for 5 years. For PKH, for example, we're doing impact evaluation PKH after almost 10 years from the starting of the program. Along the way, the programs has evolved because of the politicals and other things. So timeline is so important. How you can produce the research when it's needed by the governments, then it will be very, very useful for us. Thank you. That's my point of view from the bureaucracy side.
Thank you, Pak Pungkas. Liz, do you have anything to add on knowledge translation and research impact?
I mean, I think sometimes we can end up, I don't know enough about the Indonesian context, but I think sometimes people are working a bit in silos and they're working maybe a little bit small scale. And it takes almost the same amount of energy, I think, to produce a sort of smaller, low impact piece of research as it does to maybe work together. So collaborate a bit more, aim for something a bit bigger. When I said funding was not a problem, I mean, I think the funding is out there, but I do think people still need help in order to access it. And just finally, just to reflect back on the comment that Dr. Pankras has just made, I think there's often this slight internal tension where policymakers need everything yesterday. And research doesn't quite work like that. It does take longer. So I just think getting to know each other so each can understand the needs of the other party is really important as well.
Yeah, thank you, Liz. Anything to add, Pak Iqbal?
Yeah, I'm thinking that sometimes the issue is not the funding, but how you allocate the funding effectively. So let's say Indonesia, we have a total budget for the health spending for research, but we need to make sure that we allocate the funding to the priority and also the priority diseases and the priority program. So this is one of the problem in how to allocate the funding. So this is all my comment.
Yeah, thank you. Unfortunately, this is all the time we have for question and answer. So apologize if we still couldn't ask your question. So yeah, the next event in the agenda, we're almost in the end of the discussion. Again, thank you so much for all of the questions, and thank you for the panelists for your answer. I would like to offer some closing statement for our discussion today. The gap in global health research capacity between high-income countries and low and middle-income countries is closing too slowly. And global health research collaboration can be a way to help bridge this gap. However, there are still challenges and barriers to achieve a long-term collaboration. We need to uphold equity, fairness, honesty, and trust to ensure a healthy collaboration. Hopefully in the future, Indonesia can be empowered and find its voice as well as assert its position in global health. Now, before we conclude this session, let's take a picture together. Our colleague, Mbak Fitri, will help with taking the picture. So go ahead, Mbak Fitri. Okay. Is that all, Mbak Fitri? Have you take the picture? Okay. I think yes. I will assume that as yes. Thank you so much, everyone, for joining us today. We have so yeah. Thank you, Mbak Fitri, for the picture. And this is the end of our discussion session. Many thanks again to all the speakers, Bapak Pungkas, Bapak Iqbal, and Professor Liz. We hope we can have a more fruitful discussion in the future. I hope you all stay safe and healthy. And finally, before we close the session, now it is the time for book voucher raffle. So please, Mbak Fitri, if you can do the raffle and show us who's the lucky winner for today. So for the winner later, while Mbak Fitri randomize it, the winner later, please contact Pungki Suroyo to claim the prize. Later, there will be her contact will be posted in the chat. Oh, Rima Maulida, are you there? Congratulations. So yeah, please do contact Mbak Pungki Suroyo later, or else we're going to give your gift to the substitute. And now we're going to raffle 10 participants who will get the chance for a laptop raffle in our closing ceremony later. So please do join the closing ceremony later to get your prize if you're lucky. Thank you again for your participation in this session. So yeah, please make note of your name. Thank you. So we hope that this was an insightful and useful discussion for you. Now we will be stopping to take a 15-minute break so you can stretch or fetch some snack, take a few drinks. And before we close our session, we would like to remind you of the incredible lineup of speakers and topics we have for the next session. The next event is Parallel Session 3 with Education, Politics and Law, Energy, and Tourism Chambers. That will begin at 1 p.m. UK time or 7 p.m. Western Indonesia time. So please click on the new link shared in the chat box. You can also find it in the emails that the organizer has sent to you. This is the end of our session. Thank you so much for joining us today. Thank you so much again to the speakers.
Thank you.
And yeah, see you again in the next event.
Thank you, Pak Pungkas.
Thank you,
Pak
Pungkas.
Thank you, Pak Elizabeth.
Liz,
Bu Kartika.
and all the
Thank you,
participants.
Thank you.
Thank you all.
Thank you.
Terima kasih.
Thank you.